Hi, my name is Pratap, and I'm one of the clinical exercise physiologists here in the BCSC program. And today I'm going to be going over movement and exercise for bladder cancer patients. So, before I begin my talk today, I wanted to go over some acknowledgements for the Bladder Cancer Supportive Care Program. The BCSC program is fully funded by philanthropic donations, and we are also very grateful for the support provided by Prostate Cancer Supportive Care Program, as well as Bladder Cancer Canada. Now, the Bladder Cancer Supportive Care Program is designed to provide supportive care for both patients and their partners from the time of diagnosis onwards. So, this is both a supportive care program and a research initiative, a set of modules or programs that provide supportive care beyond treating the cancer itself. Most modules in the program include preemptive and educational themes, and patients choose modules of interest. We believe that knowledge is empowering, and educational sessions can help answer questions and relieve stress. This here is the set of modules. Module number 1, we start with the introduction to bladder cancer and primary treatment options, just a general overview of bladder cancer. Then we get into managing the impact of bladder cancer treatments on sexual function and intimacy. We have a module on wound, ostomy, and continence care, counseling services. Today, obviously, we're here to talk about movement and exercise for bladder cancer patients. We have a module on nutrition for bladder cancer patients. We have a pelvic floor physiotherapy module for patients with neobladder and bowel management. And finally, a metastatic disease management module. So you essentially find the module that is most relatable to you, and that way you can explore more information into that topic. Now today, this is kind of a general overview of what you can expect from the exercise module. So we're in a group setting today, very general discussion on the benefits of movement and exercise. We're going to go over the current exercise guidelines for bladder cancer patients and using specific exercises to manage treatment-related side effects. Now, after this module, if you feel like you need more one-on-one support or you didn't get enough information, I highly advise you to book a one-on-one session with either myself or one of my colleagues. And these can be done both in person or virtually via Zoom or telephone. So in our one-to-one consult, it's an assessment by a certified clinical exercise physiologist to go over exercise guidelines for you, right? So you can see here, we start off with the education session today, then we move into the exercise clinic. And so you can see the outline there. We start off with a baseline visit. We get to know your medical history. We'll talk a little bit about your goals. We're going to take you through some exercise tests. And using all that information, we're able to put a program together for you. Now, after that baseline visit, a month later, we follow up. We check in to make sure that things are going well. We reevaluate your goals, tweak your program if needed. Then we follow up again at the 3-month mark from your initial visit. Again, this is a longer appointment, 45 minutes. And during this appointment, we go through those same exercise tests. We follow up to see how your exercise plan is going, make sure you're staying on track, and then we revamp as needed. At this point, if you are planning to go for a surgery, like a radical cystectomy, then we follow up 2 months post-procedure. And during this follow-up, it's a 45-minute check-in, we see how the procedure's gone, and we give you new exercise guidelines that are going to be safe for you. After this, we do a 6-month follow-up, and during this call, again, we reassess how things are going, and finally, we follow up at the 1-year mark. All right, so this is the timeline that we do follow. Again, after today's presentation, if you find that you need some more information, then I highly encourage you to get in touch with our program coordinator to book an appointment. Now, today's presentation, we're going to be going over the following topics here. What is exercise? Why should you exercise? How much is recommended? We're going to go over specific exercises to manage and reduce treatment-related side effects, enhancing health and long-term survival with exercise. And then finally, we're going to go over how to get started safely. Now, to start off, we want to define what exercise is. But before we do, I want to take a step back. So we have a few terms here on the screen. The first term I want to go over is physical activity. Okay, so if we had to define physical activity, what does that look like? So physical activity essentially is just movement, right? If you were to get out of your chair right now and start walking around, technically you'd be doing physical activity. Anything that takes your body from rest to movement would be considered physical activity. So walking your dog, gardening, golfing, cleaning, housework, all considered physical activity because you're not in a state of being sedentary. Now, what's the big difference though between physical activity and exercise? So we see here a nice clean definition for exercise. Exercise is any planned, structured, repetitive, and intentional movement performed to improve or maintain one's physical health. Okay? So what's the big difference here? Physical activity is movement. Exercise is planned, structured, and repetitive, usually with some goal in mind. So for example, if you're trying to improve your arm strength, you're not going to do that by just vacuuming your house, right? You need to set aside some time during the week, lifting weights, maybe performing a bicep curl exercise, and gradually progressing to see improvements. If you want to improve your cardio or your aerobic exercise, you're not going to do that by just walking once a month, right? Again, you need to set aside time, maybe 3 days a week. You start with a 10, 15-minute walk. And as you improve, you start to progress on that. Maybe 15, then eventually becomes 20 minutes, and so on and so forth. So that's the key difference. Physical activity, of course, we want to promote. It's getting you moving. But exercise, when it's planned and it's structured, is what's going to allow us to start seeing adaptations for the body. And we'll see in a second here how it's going to help with your treatment-related side effects. And then finally, we have sedentary behavior. And this is what we want to try to move away from, right? So sedentary behavior essentially is not moving. So sitting in front of a computer, sitting in front of a TV screen, in front of your desk. And we know now that sedentary behavior is associated with an elevated risk for all-cause and cardiovascular mortality, cancer, as well as type 2 diabetes and cardiovascular disease, right? So I want to take you through 2 examples here. We're going to call the lady in the red Sarah, and then we'll call the gentleman in the green Mike, all right? So we're going to follow them through their day. So Sarah starts her morning off just like most of us, gets up, gets ready for work, has breakfast. She lives about 45 minutes away from work, so she gets in her car, drives it. Okay, so once she gets to work, she has a desk job. So the majority of her day is spent sitting in front of that desk. And maybe outside of going and talking to a colleague, maybe using the bathroom, lunch, grabbing her lunch, and then coming back to her desk, she's not really doing a whole lot of movement at work, okay? Physical activity, essentially. Then she gets back in her car, drives home, stuck in traffic, right? So it takes a little bit longer. And when she's home, she's exhausted. So she has dinner in front of her TV, calls it a day, and repeats the same thing the next day, all right? So, how much movement, right? Physical activity and movement has Sarah really done in that day? Not a whole lot, right? Versus Mike, right? So Mike is lucky enough to live about 25 minutes away from work. So he actually walks in, okay? So he walks to work. He also has a desk job, but he recalls, he said, I had that presentation with Nick, and he was mentioning that I need to try to get up and move around periodically, at least every hour. Okay, so he does that. So instead of sitting, he notices he's been sitting for an hour, he'll get up and go grab some water, or he'll get up and go talk to a colleague, all right, intentionally. Lunch comes around, so for half of his lunch, he has a meal, and the other half, he's gonna go for a walk. And then finally, when work's done, he walks home, goes for a bike ride, has dinner. After dinner, he does a woodworking project. And then once dinner's done, he actually walks his dog and then calls it a day, right? So night and day difference between Sarah and Mike, right? Sarah, again, very sedentary, where Mike is being very intentional at how he adds in movement. So you might ask, well, Nick, why is this so important? So your body is very good at adapting what you put onto it, all right? If you end up sitting a lot, your body's gonna be like, hey, you don't need to keep these muscles around. They're gonna start disappearing, what we call atrophy, which leads to weakness in the muscles in your legs. Your metabolism starts to slow down. You start to put on weight in areas you don't want to, namely the belly, maybe hips. And that can significantly start to increase risk for things like cardiovascular disease, diabetes. And the longer you sit, I'm sure we've all experienced it, the greater the risk of muscle stiffness, soreness, and long-term potential injury, right? So by adding movement, like what Mike's doing, we essentially tell your body, hey, I'm using these muscles, I gotta keep them around, because muscle, again, is very metabolically demanding tissue. So if you stop using it, your body wants to get rid of it right away, and it's gonna take those extra calories and store them as fat, right, which we don't wanna see. So by telling your body and gradually adding in movements throughout the day, you're saying, hey, I gotta keep these muscles around, you reduce that stiffness, you keep your metabolism boosted, and by adding in those small bits of movement at least every hour, you have a compounding effect. So this is very important, especially if we're working on trying to add or work on weight loss rather, okay? So Our goal then should be adding in what we call these exercise snacks, okay? Bite-sized bits of movement throughout the day so that you can promote that to your body and let it know that, hey, I'm trying to stay active. We want to keep this muscle around. Essentially, our big recommendation then is we want to try to move more and sit less. And if you can, some examples around this may be putting your remote up by the TV so that it forces you to get up and change the channels. Maybe it means if you're watching TV and a commercial break comes on, you sit and stand 5 to 10 times, right? Maybe it means setting a timer or you're just looking at the clock, and every hour on the hour you get up and you walk around, maybe from your living room to your kitchen. Maybe it means just going to a wall and doing 10 push-ups. Any movement that's going to promote activity will keep that body and the metabolism boosted, and that's going to have a great compounding effect for you. And we're going to see how important that is also as we move ahead here towards some of the treatments. Why is exercise important before and after surgery? So it's very important we try to prepare our body prior to surgery, right? So by combining exercise and good nutrition before surgery, also known as prehabilitation, this can help you recover faster and feel stronger afterwards. Exercise is part of cancer care, so staying active can reduce fatigue, anxiety, depression, and help you feel better, both physically and emotionally during your treatment. Moving your body matters. Being inactive increases the risk of weight gain, diabetes, and other conditions that can affect overall health and bladder cancer risk. And finally, mix it up to live longer. So people or patients who both aerobic exercise, example walking, and strength exercises, example dumbbells, tend to live longer and stay healthier. So we really want to promote trying to not only get your body in the best shape possible prior to your procedure to really limit any complications and reduce the outcome of potential side effects, but once your surgery or your procedure is done, or once you're going through your treatment, we really want to try to maintain or get back into an exercise program as soon as you're able to, because that's going to have a big impact on reducing your risk of the reoccurrence of the cancer, managing some of the side effects, but also mitigating your risk of having other chronic diseases occur. So here, I'm sure this is not a new list for you. Some of the benefits of exercise, from cardiovascular health to improving bone density, bladder incontinence, helping with sexual function, improving body composition, maintaining weight, improving mental health. So there's a lot of great benefit to performing exercise on a regular basis. Now, the real question is, how much exercise is recommended? When I like describing exercise, we like going through these 4 pillars, all right? So we have what's known as aerobic exercise, resistance training, flexibility, and balance, all right? So we're going to touch on each of these. But before we do, I want to go over a principle that myself and my colleagues use to prescribe this exercise, and it's known as the FIT principle, okay? So it's an acronym. It stands for frequency, intensity, time, and type. And I just want you to ask yourself these questions prior to us going over the definition of each of those pillars of exercise, okay? So the first one is frequency. How often do you exercise? So do you consider just going out once a week enough? Do you go twice a week? Do you do something every day? Intensity, how hard do you push yourself? So do you consider walking at a very light pace where you can whistle or sing a song? Hard enough intensity. Or do you have to be completely winded? Or are you still able to maintain a conversation when you're exercising? Time, how much time do you spend exercising? Do you do 10 minutes once a week? Do you do 30 minutes every day? Do you aim for an hour a day? So what's the general recommendation there? And then finally, type. What mode of exercise are you doing? Do you consider golf exercise? Do you consider cleaning your house exercise? Do you consider going for a run exercise? So again, ask yourself these questions, and we're going to come back and touch on each of these as we go through the 4 pillars. So aerobic exercise. If we had to go over some examples, so these may be things like going for a walk, swimming, running, cycling, dancing, okay? So it's essentially an activity that you want to be able to sustain, so it's generally repetitive, for a period of time. So it gets your heart rate up, gets your breathing rate up, you sustain it, and then once the activity is done, you're able to gradually bring yourself back down to baseline. So the current Health Canada recommendations are 150 minutes per week of moderate to vigorous intensity aerobic exercise. So we're going to define moderate to vigorous intensity in a few slides here, but 150 minutes per week seems like a big number. So if we break that down, works out to about 30 minutes a day, most days of the week. And if you break that number down even further, that's about 10 minutes 3 times a day. So you're thinking, 10 in the morning, 10 in the afternoon, 10 in the evening, up to 5 days a week. All right. And so when you start thinking about it that way, it makes it much more bite-sized and easier to actually perform. Okay. So we're going to come back. We're going to touch on the intensity in a second, but that's ideally what we're trying to aim for. If you're brand new to exercise, of course, I don't want you to shoot for 150 minutes right away. Instead, maybe it means just starting with, a couple 10-minute walks during the week and gradually progressing from there. And if you have questions, of course, you can always book in with one of our clinical exercise physiologists. Resistance training. So we know as we get older, unfortunately, we see a reduction in muscle mass and strength. We hit peak strength and muscle mass at about age 30. And then every decade after that, we see a steady decline. And then roughly around the age of 65, 70, we start to see an even more significant decline. So it's going to happen to you, it's going to happen to me. But what we can do about it is reduce how quickly we see that decline happen. And essentially the main way to do this is going to be through resistance training. Our goal is to target the major muscles of the body. So think your chest, your back, your legs, your glutes, your core. We want to target these big muscles of the body at least twice a week. And we want to do it in a way where we're stressing the body, but not overdoing it to the point where we're sore for multiple days on end. Okay, so we're going to come back. We're going to touch on resistance training in a few slides. But essentially, our goal is we want to aim for 2 days a week of strength training. And again, we want to focus on targeting those major muscles of the body so that we can maintain our strength and our muscle mass. Because, of course, when you're in your 20s and 30s, it's nice to have the aesthetics. But as we get older, we really want to start focusing on independence, right? And what's going to allow you to continue to do your own day-to-day tasks without having to rely on someone else. Next up is flexibility. So usually when I give these talks live, I throw it out to the audience. I ask, how many of you have dealt with some form of an injury, right? A neck issue, a back issue, shoulder issue, right? And I'd say 80% of patients' hands tend to go up. And many times, a lot of these injuries are around the stiffness, right? Around muscles, but mainly around the joints. And we know that as we get older, muscles tend to get stiffer, okay? And when those muscles get stiffer, we know that injury risk can go up. So our goal then is what can we do to maintain our flexibility as we get older? And one of the best ways to do this is going to be through stretching. So the best time to stretch is right after either an exercise routine or a warm shower. Your body's warm, so it's going to be much easier to lengthen out that muscle. Now, I've been asked, well, Nick, I've been stretching first thing in the morning for 20 plus years. Does that mean I need to stop? The answer to that is no, right? If you've built a routine, you feel comfortable, then you can continue on with that. But if you're brand new to stretching and you've never done it before, I wouldn't encourage that because you really increase your risk of injury. And the last thing we want you to do is suffer a muscle strain or a pull. So if you are just starting out with a stretching routine, try to aim for those 2 times after a warm shower, after a workout, so that you reduce risk of injury and your stretching will be much more effective as your muscles are warm. And when it comes to stretching, best case scenario, you're doing it most days of the week, okay? Now, lastly, we're going to finish off with balance. So we know that as we get older, balance does become affected in most individuals, right? Especially after the age of 65. So if you're someone that's at high risk of falling, if you're someone that's osteoporotic and you can't afford to take a fall, or you're just older and again you take a fall, you significantly can increase your risk of having a fracture happen, especially in the hips, and that can leave you bedridden for months on end. And not only does that take a physical toll, of course that's going to take a mental toll. You have to start relying on other people. So we want to prevent all that from happening in the first place, right? And so we put a strong emphasis on doing balance exercises here in the clinic. And our goal is to essentially, again, help prevent you from taking these falls, okay? And if that is an area that you're looking to work on, again, I encourage you to book in here with one of our clinicians so we can put a program together for you. Now this here is what we call our exercise continuum. So I'm never going to be like, all right, Joe, get up off the couch and just start sprinting as hard as you can, right? That's not a good protocol. You significantly put your muscles at risk for strain or for injury. You put your heart at risk. It puts a lot of stress on the heart, especially if you're a heart patient, so you're taking medications to control your heart rhythm or rate. And so we want to go through these 3 phases of exercise to reduce your risk of injury, all right? So we always want to start with a warm-up. Now, if you look at the effort there, it says light, okay? So if you come over to the right side of the screen there, you see what's known as RPE, rating of perceived exertion. So this is a scale from 0 to 10 that tells us how hard exercise feels for you. So 0 to 2 is light. Light means you can easily whistle or sing a song. 3 to 6 is moderate. Moderate means you can talk, but you can no longer sing. And then 7 to 10 is hard. Hard means you can barely talk, maybe 1 or 2 words, okay? So when we're doing the warm-up, you should not be gasping for air. If you are, you're pushing too hard. The whole purpose of warm-up is to get the body going, gradually warming your muscles up and slowly increasing your breathing and your heart rate. And it's preparing you for the hard stuff, okay? So once that 10 to 15 minutes is done, now we can push you a bit. So we get into what we call the conditioning phase. And during the conditioning phase, this is where we can get you more so into that moderate intensity zone. If you're still in the easy zone where you can whistle or sing a song, you have room to push a little bit harder, okay? 30 minutes or more is the recommendation. Again, this can be done in 10-minute bouts, okay? This can be done in 2 15-minute bouts. It can be done in 30 straight. So ideally, we don't want to aim for anything less than 10 minutes at a time in this zone. Now, if you're just starting out, you're a beginner, of course, you can go with 5 minutes and work your way up to 10. But the most benefit starts to happen when we get into the 10 minutes at a time in this moderate intensity zone, okay? And then finally, we finish with cool down. So you don't want to just finish a hard exercise session and sit down, right? You want to spend some time either walking around at a slow pace. So just like with the warm-up, you can start light by walking around. You can do level 1 on a piece of equipment, just something to get the heart rate going. Same thing with the cool down. You can go back down to level 1. You can do a light walk. It's also a great time to do stretching because your muscles are warm. And the whole purpose here is to bring everything back to baseline. If you just suddenly sit down after a hard exercise session, you run the risk of having blood pool in your legs and potentially getting dizzy. So to avoid all that, make sure to add in that cool down. Again, it's supposed to be a light effort. It'll be very beneficial for you. Now this slide here is going over intensity, right? We talked a little bit earlier about moderate to vigorous, and you saw it a bit in that last slide there, but just to reemphasize, most patients, when they train in this moderate intensity zone, and I'm gonna explain why. So if we look at the talk test, you can have a conversation, but you can no longer whistle or sing. If you look at the scale, you're usually about a 3 to 6 out of a 10. And looking at heart rate, you're training at about 50 to 70% of heart rate max. Normally, I don't like giving patients a heart rate training range, and I'll explain why in a second, but I do get asked the question. So if we're looking at a very basic formula, some of you may be familiar with this, you take 220 and you minus your age. So for simplicity's sake, let's use a 20-year-old. So you take 220, you minus 20, you get 200. You take that 200, you multiply it by 0.5, you get a percent. And then you take that 200, you multiply by 0.7, and you get a percent, right? And so that gives us a range of training that person between 50 and 70% of the heart rate max. Now, why do I not like this? Well, 2 reasons. 1, if you're on a medication, let's say like a beta blocker that suppresses heart rate, that will obviously affect the outcome of this formula, right? You won't be able to necessarily get it as high as someone your age that is not on the medication. The other reason I don't like this is if you're a very fit individual, right? Your resting heart rate is quite low, so it's going to take much more time to get your heart rate up. So this formula won't apply. And on the other end, if you're very deconditioned, right? Just even getting off the couch and walking a bit might send your heart rate through the roof. So again, it won't apply, this formula. So instead, I really advocate for patients to go off of the talk test and to follow the RPE scale. Now, when it comes to vigorous intensity exercise, can we still do this? Of course, but I just want to put into context what it feels like. So for vigorous intensity, you cannot say more than a few words during activity. So think, you're rushing to get a bus, or you don't want to miss that bus, or you're rushing to get to an appointment, right? On the scale, you're about a 7 to 10 out of 10. And in terms of intensity, you're training of roughly 70 to 85% of your heart rate maximum. So much harder to maintain. Now, can you do the vigorous intensity activity? Of course, right? If you're just starting out, I wouldn't advise to do that. I would instead start you in the moderate zone and work our way up to vigorous. But if you've been exercising for a long time, you have a good grasp and handle on it, then I would advise to start pushing a bit. And one easy way to do this is through interval training. We're going to spend some time talking about that in a few slides here, but essentially it's a period of higher intensity exercise, usually maybe for 30 seconds to a minute, followed by a period of recovery, where you bring your heart rate down. So you push, that's where you exert hard during the working phase, and then you reduce your intensity and recover, and that's during your recovery phase. And you go back and forth between those two intensities for a period of time, then you carry on with the rest of your day after that, okay? And we're gonna come back and discuss that in a few slides. So why do we wanna promote aerobic exercise? Well, research shows that exercise can increase long-term survival. Aerobic exercise reduces obesity risk, which is a risk factor for bladder cancer, and bladder cancer patients respond well to pre-surgical aerobic interval exercise, and the improvements in cardiopulmonary fitness could have important implications for post-op recuperation after radical cystectomy. So for those of you that have had a procedure like a radical cystectomy, by improving your aerobic fitness prior to that procedure, it can help you bounce back a lot quicker and recuperate a lot faster post-procedure. Now, interval training. I want to spend a bit more time talking about this. So why is it beneficial? Well, we know that short periods of very high intensity movement followed by short periods of rest have been shown to be more effective than moderate aerobic exercise. It can have improvements in body composition, help lower your blood sugar levels, be very time efficient, right? Especially if you're not looking to be in a gym for an hour. It's considered very safe if you're doing it properly. Now, a starting point I have many patients do is a simple example here would be walking, right? So if you're going out for a walk, do your warm up for 10 minutes, then you get into your intervals. So you can do 30 seconds fast, and remember, fast is considered to the point where you can maybe only say a couple words, and that's followed by a 1 minute recovery, right, at a slow pace. And that slow walk means you can easily whistle or sing a song again while you recover. And then you go fast again. So this could be a power walk or a jog. And again, you're only able to say a couple words, and this is followed by a recovery where you can easily whistle or sing a song. And then you can go back and forth like that for upwards of 20 minutes to start. And then you carry on with just your regular walk after that. All right. And so this is a great way to have that intensity without overdoing it. Also shown to be very beneficial in improving your aerobic capacity. Okay. So if you're looking at starting this, again, I gave you some arbitrary numbers there. Maybe it means you have to start 15 seconds fast and a minute and a half recovery, or maybe you can just go 10 seconds fast and then work your way up to 15, 20, 30 seconds fast. And the goal is eventually get to a 1-to-1 ratio. So you do a minute fast, a minute slow, and then eventually maybe you're doing a minute and a half fast, a minute slow, and then 2 minutes fast, a minute slow, so on and so forth. Now, resistance training is measured by sets, reps, and load. So we're going to go ahead and define what each of these terms mean. So a set, essentially, is how many groups of exercises, or rather how many groups of that specific exercise you do. So for example, if I'm holding weights in my hand and I press them above my head and I do that 10 times, I just performed 10 repetitions. That's the amount of movements that I just executed. I put those weights down, I take a break, I pick the weights up and I do another 10. I would have just completed my second set of 10 repetitions. And then I put those weights down, I take a quick 1 minute break, I grab the weights again, and then I push those weights above my head and lower them down. I would have just completed my third group or third set of 10 repetitions. Okay, so sets, again, how many groups of repetitions you perform. Repetitions is how many times you executed that movement. And then load is how much weight you're using. Okay, so let's say in this example, I had 10-pound weights in each hand. My load would be 10 pounds, right? If I'm using no weight, then my load would be my body weight. If I'm using resistance bands, the weight is, or the load is going to be the weight of my bands. The recommendation is that you build up to 2 to 4 sets of 8 to 12 reps, and you're using the correct weight if at the end of the set, you can't perform any more repetitions. So for example, let's say we put a protocol together for you, and your goal was to do 3 sets of 10. So you go home, you're doing your first set, You're doing bicep curls. You get to 8, 9, 10. You're trying to do 11. You can't do 11. Perfect. You failed at the 10. Second set, same thing. You're at 8, you're at 9, you get to 10. Done. Good. Failed at 10. Third set, same thing. So you executed the right amount of reps and sets. Now, if you went back to that same example and you got to 10, but you're like, oh, I can easily do 11, 12, 13. Good. Second set, you get up to 11, 12, 13 again. This now is showing me the weight's too light. So if for 2 sets in a row, you're able to do more than the required repetitions, now you can gradually go up in weight by a couple pounds. If on the other end, you're not even able to execute the required repetitions, again, the goal was 10 reps, but you're only able to get up to 8 or 7, then the challenge here is the weight is too heavy. So the recommendation would be to lower the weight so that you can get to the required 3 sets of 10, okay? We want to follow the 2x2 tempo, and this is just so you don't use too much momentum. So on the up phase, or when you're lifting the weight, that's when you want to lift with 2 seconds, followed by a 2-second relaxation. Okay, so if you're doing a push-up, for example, 2 seconds as you push away from the floor or from the ground or from a wall, and then 2 seconds as you lower your body back down. Okay, if you're doing a squat, so 2 seconds as you stand out of the chair, 2 seconds as you sit back down into the chair. If you're doing a bicep curl, right, with the 2 weights in your hand, 2 seconds as you curl that weight up towards your arm, and then 2 seconds as you lower the arm back down to a straightened position. So that will help reduce the chances of you using momentum. You want to make sure you're performing full range of motion. So for example, if I did that shoulder press exercise, you want to push that weight all the way above your head so the arm's fully straight, and then bring it back down to a 90-degree bend in that elbow. Okay, if you're doing a bicep curl, you want to bring that weight all the way up to the shoulder and then lower it back down to a fully straightened arm. If you're doing a squat, again, standing all the way up in the chair and then sitting all the way back down. Now, of course, some situations you may need to modify based on injuries. Maybe you have a shoulder issue, maybe you have a low back issue, and maybe your knees don't allow you to squat all the way down. That's totally fine, right? But in most cases, if you can get the full range of motion, this will just ensure you use the muscle in its entirety. If you only go halfway up on a bicep curl or halfway up on a shoulder press, you're not engaging the entire muscle, and that's not giving you the most bang for your buck, right? So if we're going to be, setting aside some time to do these exercises, we want to make sure we're executing them properly. You want to make sure you take breaks in between sets, so you don't want to just do one after another, because your muscles do need time to recover, right? If you try to do that, you're not going to be able to get to the required reps and sets, and you can significantly increase risk for injury. So your body needs to recover between sets. If time is of the essence and you're looking to be more efficient, I would recommend doing supersets. So what does that look like? So for example, let's say you did a push-up exercise for the chest. While recovering in between sets for the chest muscle, maybe throw in an exercise for an opposite muscle group, like a back. So you can do like a row exercise where you have 2 weights out in front of you and you're pulling them in towards the body. Or maybe you do something for the chest and then you work on something for the legs, right? You just don't want to work the same muscle group while it's recovering. And then as soon as you, let's say, finish the row exercise, you've given the chest enough time to recover, then you go back to doing that push-up exercise, okay? And then finally, you want to make sure you're breathing. I know this one, seems like a given, but many people, when they're lifting weights, they tend to hold their breath. And when this happens, you can spike blood pressure, which of course we want to try to avoid. So ideally, you want to just breathe throughout, right? You want to breathe out on the exertion and you want to breathe in on the relaxation phase, okay? Now this slide here is just showing some of the exercises we may be prescribing to you, but more so than none, we want to emphasize that we always provide modifications. We have patients come through here that have been exercising for 30 plus years, and we've had patients come through that's never done any exercise a day in their life or stepped foot in the gym, right? And then obviously everything in between. So why do I bring that up? Because we meet you halfway, right? We're always able to provide modifications to meet your specific needs when it comes to your exercise prescription. So for example, if you've never done a squat, I'm not going to put a bar on your back and get you to do that, right? So maybe it means starting with a squat off of the chair and having a chair in front of you to assist you, right? Especially if your legs are very weak. And then eventually, maybe you're just pushing off your legs to stand up. And then you don't need to push off your legs, use a tabletop. You're able to get up on your own and then sit back down in the chair. And then finally, you push the chair back and you're able to just do free body weight squats. Push-ups, right? If you're new to push-ups, I'm not going to stretch you on the ground. So Maybe it means starting with push-ups off the wall, and then from the wall you move to a table, and then from a table you use the floor off your knees, and then finally you do regular push-ups off the floor, and then the plank to engage the core, same thing. Maybe instead of starting on the floor, we start on the wall and then progress to a table or a chair, and then finally you're able to do planks off the floor via your knees, and then eventually progressing to doing planks off your toes. Now the goal is not to look like this. This guy's obviously doing a lot of extracurricular activities, right? But the real goal is functionality. So I get asked the question all the time, well, Nick, I don't really care about lifting weights. I'm not trying to, look like what I did in my 20s. And that's fine, right? But what I really want to emphasize is our goal is when we're, in our 70s, 80s, 90s, hopefully we're living to 100 years old, you maintain that independence, that functionality, right? So you still want to be able to walk up the stairs on your own without having to use an aid. You want to be able to carry your own groceries. You want to be able to get out of your bed, get out of a chair, play with your grandkids without having to rely on someone else. So we really want to focus on maintaining our independence, and that's what strength training does for us, right? If we can engage these muscles and keep them strong, like I brought up earlier, how unfortunately as we get older, we're going to lose this. But if we can do exercises to maintain the strength, then we can maintain that functionality way into our later years. Now, what about power? So what is power? So we use what are known as fast twitch fibers, muscle fibers, to produce force quickly, such as during brisk walking, reacting when we're off balance, like preventing you from falling, and everyday activities like going upstairs. But if you're trying to go up those stairs very fast, these fast twitch muscle fibers kick in to allow you to do that. However, as we age, unfortunately, we start to see a reduction in these muscle fibers, which means we tend to start moving a bit more slowly. So by adding in speed, when we lift weights, we can target these important muscle fibers and prevent or slow down their loss. So this may mean something as simple as lifting a weight quickly, like doing a bicep curl, and then having a very slow relaxation or down phase, right? So maybe 2 seconds to lift that weight up quickly, and then 4 to 5 seconds as you lower it back down, and then quickly lift it up, and then lower back down. So that's just one example. Personally, I emphasize more so of the general resistance training first. And then if you're someone that's experienced, you're really looking to work on power, then we can start adding in some of these exercises. Balance is also very important, like we highlighted a little bit earlier. Treatment side effects can influence balance and increase the risk of falls and injury related to reduced bone density. So balance and functional training, in addition to other types of activity, are recommended to reduce falls. So there's many ways we can work on balance out there, whether it's an app like Clock Yourself. You can stand on one foot while moving your arms up and down, to the side and down. Maybe it means just turning your head to train some of the, what we call the otolith organs in the ears that are responsible for helping with balance. We also want to work on stability of the ankles, right? So even something as simple as standing on a pillow and shifting your weight side to side can work a bit on that ankle mobility. And a very simple one, and just make sure, you're being safe here and have a table in front of you, but even just standing there and closing your eyes will disrupt your balance. And so it's a great way to train it. So we want to make sure we're safe, right? So in order for it to be effective, you do need to feel a bit of a wobble in those feet. And you want to make sure to stand near something, table, chair, wall, so that if you do feel like you're going to fall, you have something to hold on to. What we're going to talk about next is specific exercise prescriptions, especially to manage and reduce treatment-related side effects. If you've had a cystectomy and you're looking at doing exercise, what are some of the restrictions and how quickly can you return to doing activity? In the initial 6 weeks after surgery, it's highly recommended to avoid strenuous activities as well as heavy lifting. So the general guideline is to avoid lifting no more than 2.5 kilograms for the initial 4 weeks. And this isn't just weights, right? This can include groceries. This can include your kids or your grandkids. This can include household chores around your home. When you do reinitiate into exercise, so after that 6 weeks, we're starting light, right? I get many patients to start with very basic or quote unquote light resistance exercises, which I'm going to actually show you in the next slide here. You start light, you can do gradual, slow, short duration walks, just to really get the body going, right? And really what we're trying to do here in these first few weeks after you get cleared to resume exercise is we want to see how the body's reacting, right? So you're kind of going through a checklist of questions saying, okay, well, how does my body feel during this activity? Do I notice an increase in pain? How about later in the day, right? Is there more pain after the activity I just did? When I wake up the next morning, do I notice any more discomfort? If you answer yes to any of these questions, then it's probably too soon for you to be adding that activity in. But if it comes back and your body's not giving you any red flags, quote unquote, then you can slowly start to add a little bit more. And this is definitely a time where working with an exercise specialist comes in very handy, because they can address any concerns you may have to know whether or not the symptoms you're feeling are normal. And when you are ready, we can start to progress that protocol, right? So maybe it means a light walk for 15 minutes most days of the week. And now you're able to gradually add time on, right? You check in with yourself during the walk. I'm not feeling any pain. The next morning I was feeling fine. After 1 or 2 days of that, maybe 15 minutes becomes 17 minutes. And you do that for the next couple of days. And if you're feeling okay, then 17 eventually becomes 20 minutes, right? So on and so forth. But again, if you do have any questions around this, I would highly encourage you to book in and chat with myself or again, one of my colleagues regarding your exercise prescription. Now, stomas and prevention of peristomal hernias. Now, stomas can weaken the abdominal wall, making it easier for peristomal hernias to occur, right? So the site where surgery occurred does have a tendency to have a hernia happen. So our goal is to prevent the occurrence of the hernias. And essentially, we want to do this by avoiding exercises and activities that put too much stress, especially on that abdominal wall, right? So things like crunches, sit-ups, some of those classic exercises many of us may have done in the gym, and very heavy lifting. So heavy lifting, I like defining as a point where you're lifting something and you're holding your breath. Those are things we do not want to do, because those significantly increase the chances of these hernias occurring. So instead, we want to perform exercises like pelvic tilts or knee slides or bridges, similar to what I just went over after having a cystectomy. We want to start with these gentle exercises. Now, start with low resistance, progress these exercises slowly, and gradually help to rebuild strength in this area. And in some situations, it may be advisable to use an ostomy hernia belt, right, to provide a little bit of extra support. That may be something you can always bring up with your doctor to see if it's beneficial for you. Here are some of the examples, especially after surgery, that I have patients do to, again, reduce risk of having hernias occur, but slowly start to engage their core muscles. So an example here is a pelvic tilt, where you just tuck your bum under your pelvis and then you flatten your back. So you arch your back and you flatten your back. So that works on rotating that pelvis so that you can start to slowly engage the core muscles. We have what's known as the knee slide. So you're laying flat on your back. You slightly push that low back into the ground and you push one heel straight out until your leg's flat on the ground. And then you pull that heel back in to a 45-degree bend. And you repeat that for 1 to 3 sets of 10 to 15 repetitions, a couple times a week. And then finally, you can do the bridge exercise, where you're, again, laying flat on your back with your knees bent 45 degrees. You squeeze the bum muscle and you lift the hips straight up in the air, and then you lower your hips back down. And again, 1 to 3 sets, anywhere from 10 to 15 repetitions. And you gradually can progress these exercises as long as your body is feeling comfortable to do so. Now, exercise can also help mitigate fatigue, right? It's estimated that over 80% of cancer patients experience fatigue at some point. And if you adopt a rest strategy, you will increase your fatigue level. So it's similar to that example I showed you, or talked about rather, earlier in the presentation. We had Sarah and Mike, right? Remember how if you sit a lot, your body adapts to that. And so weight gain occurs more easily. Muscle mass loss occurs more easily. But fatigue also comes on, right? Contrary to popular belief, many of us think, well, when I'm tired, I should just sit and do nothing. That actually exacerbates your fatigue. So we're not saying to get out and run marathons when you're tired, but we do want to promote smaller doses of exercise, like those exercise stacks we talked about, so that at least you can keep the body going, and that's going to help mitigate some of the fatigue. So aerobic and resistance exercises have been shown to be the most effective management strategy for fatigue when correctly prescribed, and even more effective than medication. So to enhance energy, exercise regularly, daily, in manageable doses, and build up your volume and intensity slowly. Here are some suggestions on ways where you can help to mitigate fatigue, especially if that's something that's becoming a barrier for you. So ideally try exercising earlier in the day. When you wake up, in the morning time, your energy is usually at its peak or its highest. And as the day goes on, as events come up, you slowly start to drain more and more energy. So I advise patients to work out earlier or exercise earlier in the day versus at night. Break exercise into smaller bouts. So this might be, instead of doing 30 minutes straight, you're doing 3 10-minute bouts throughout the day. Maybe it means reducing your walk time for that day. So if you're normally going for 60-minute walks, take your pace down to 20 minutes for that day. And then when you have a bit more energy, maybe it means you can increase your duration. Try getting up every hour and walk around for 5 minutes. So maybe you're bedridden and it's just so challenging. Even just getting up on the side of your bed and sitting and standing 3 to 5 times, or just kicking one leg out and lowering it, and then extending your other leg and lowering it. Doing that for 5 to 10 reps on each leg will help to get that blood flow going, and even that has an impact on reducing your fatigue. Okay, you can take those exercise breaks we were talking about, right? So during TV shows, sitting and standing 10 times, going to a wall and doing push-ups can be beneficial. Now, you did too much if either of the following happened. So let's say you worked out on Monday, Tuesday you're a bit sore, Wednesday you're a little bit more sore, but at no point where you're just bedridden and not able to do your day-to-day tasks. And then by Thursday, you're feeling great and you're probably ready to do another workout. Okay, so that's kind of the normal protocol we want to see. What's not normal is if you did a workout Monday and the rest of Monday is a write-off. You're not able to do anything. Or you did a workout Monday, Tuesday, Wednesday, Thursday, Friday, you're so sore you can't do your day-to-day tasks. That's a problem. So muscle soreness should not last more than 2 days. And if you cannot do your day-to-day tasks, you're having a hard time getting out of bed, ADLs stands for activities of daily living or your daily work. If you're having a problem with that, then too much has been done. So that's where you and I need to sit down, have a conversation, and see where we can revamp your exercise plan. Now, exercise can help with body composition changes as well. So pre-op or prehabilitation, exercise and dietary interventions have been shown promise in improving functional outcomes after surgery. Right? Bladder cancer patients with lower skeletal muscle mass are actually at an increased risk of early complications, cancer-specific mortality, and all-cause mortality. So what are we trying to do here? Especially if you're going in for surgery, just regardless of the treatment, but in particular having a cystectomy done, we want to try to get that belly size down as much as we can, right? That's going to help reduce the risk of complications. So if we can prepare the body, it's going to be very beneficial. We also want to work on strengthening that abdominal wall, right? That also will help reduce complications post-surgery and help you recover faster. And finally, when it comes to weight loss, especially around that abdomen, we know that more than half the battle is going to be diet, right? So if you find that you're struggling with your nutrition, I do advise patients to check out our nutrition module and potentially considering booking with one of our nutritionists to get some guidance there. Exercise can also help with sexual health and libido. So exercise is positively associated with quality of life in bladder cancer survivors, including sexual function. And patients with bladder cancer meeting exercise guidelines did show improvement in sexual function as well as erectile function than those patients who remained sedentary. So just something about getting in the gym and starting to do some form of exercise that just has a response in the body to gradually start to improve sexual function. Now, do you know exactly what that is yet? No. But if sexual function is an area that you're struggling with, I do highly recommend to check out our sexual health module. We do have a sexual health nurse here that can help yourself along with your partner explore ways to regain some of that function if it is an issue for you right now. Other side effects. So mental health. We see a decrease in mental health, and it can be very common in bladder cancer patients. Quality of life. Most patients will experience changes in quality of life. I mean, you're going to all these new appointments. Some of you are considering, what's the best treatment option. It can be quite stressful. Some of you might already be on the treatment and, you've gone through your surgery and now you're dealing with this bag and, everything that comes with that, or you're going through chemo, so on and so forth. So it can be very overwhelming, right? And no one really knows how you're feeling. I mean, your friends, your spouse, they may be trying to help you, provide support, colleagues, but at the end of the day, they don't truly know what you're dealing with. And, many of us, we suppress these emotions, and that actually makes the stress even worse, right? And the anxiety worse. So instead of doing that, we encourage you to potentially reach out, find middle ground. And that's why it's great talking with someone like our clinical counselor, Daniel. He sits down with you and he meets you halfway again. And based on the conversation, the two of you decide what are the best strategies to help mitigate maybe some of that stress you're experiencing, and how to overcome some of those challenges. So if that is something you want to do, again, you can reach out to our program coordinator to book one of those appointments with our counseling services. So bone metastases and advanced cancer. So if you do have cancer spread to your bone, it is still safe to exercise, but I do highly encourage you to sit down with an exercise physiologist so that we can tell you, or rather do an assessment first and let you know what is an appropriate exercise for you to be doing, and based on the assessment, what exercises we should be avoiding. And we're also able to look at some of your scans to see whether or not certain movements may cause pain or discomfort, and then put a protocol together for you. Peripheral neuropathy, this may occur after chemotherapy, so this is when you have a loss of sensation in your hands or in your feet. If you have it in your feet, that can start to lead to issues with balance. So exercise can help to a degree, but it is good to bring this up with your doctor. Lymphedema, this can occur after lymph node removal, as well as radiation therapy. So if you notice swelling in the legs after a procedure or after radiation, definitely bring that up with your doctor. They may prescribe medication to get rid of the swelling. They may prescribe compression stockings to help alleviate some of that swelling, but a good discussion to have with your physician. We want to make sure then we're choosing exercises that will specifically reduce and manage the side effects of your bladder cancer treatments and the response to those treatments, right? So how do you get started safely? Well, if after today's presentation you felt you got what you needed, great. Wishing you all the best with your exercise journey. Just remember, I didn't get to know you. I don't know your specific medical history. Yes, you're dealing with bladder cancer, but are you dealing with other things, right? Do you have heart issues? Do you have lung issues? Are you dealing with certain musculoskeletal issues that limit exercise? So if you don't talk to a healthcare provider, it is encouraged for you to speak with your family doctor before starting any exercise program. Once you get the green light, then of course, go ahead and start that program. Post-surgery treatment, when is it safe to start? So we did discuss that a little bit earlier, but I do still recommend speaking with a professional so that you can get those specific guidelines for yourself, and someone can keep track of you while you're going through your recovery post-surgery. Working with a qualified exercise professional to help safely guide you through an exercise plan. Always include a warm-up and a cool-down that incorporates the mild exercise and stretching. Again, you want to have that easy effort to start the program, and then it's followed by an easy cool down, stretching, low intensity activity to bring things back to baseline. And then finally, starting slowly and building slowly, right? So if you're on a piece of equipment, you're not going from level 1 to level 10, right? Maybe it means starting at level 1, you've been doing that for a few weeks, and then level 1 for 5 minutes. Maybe you progress to level 2 for 5 minutes, and then you do that for a week, and then eventually you progress fully to level 2 for that full 10 minutes. If you're weight training, maybe it means you're starting with 10-pound dumbbells, and you go from 10 reps to 12 reps to 15 reps for 3 sets, and then now you're ready to go up in weight. Now it means you're going to go up to 12 pounds, but you're going to go back down to 10 reps and then progress to 12 reps, and then finally 3 sets of 15 reps. And that's another great way to progress. Okay, so remember, some activity is better than none. The next recommendation here is if you do decide to consult with an exercise physiologist, a clinical exercise physiologist, or any qualified exercise professional, if they're a part of any of these governing bodies, you can rest assured that they have the scope to be able to work with you. What we don't want to see happen is, of course, there's great trainers out there working with kinesiologists, but they may not have the knowledge base to work with bladder cancer patients. So for example, let's say you had your surgery and you go back after 8 to 10 to 12 weeks, and you're working with your trainer and they got you doing planks, and you're like, oh, I really feel a lot of discomfort right now. And the trainer is like, no, that's just because you haven't done any exercise for 12 weeks. But realistically, they don't understand that might actually be doing some damage. It's not their fault because they haven't been trained to work with that clientele. So instead, I encourage you to at least work with an exercise professional that's trained to work with bladder cancer patients. Get the do's and don'ts, what's appropriate for you for exercise right now versus what's not. And then use that protocol and bring it over to the trainer that you're working with. And if they have any questions, Many times these qualified exercise professionals are able to meet and discuss, or it might be a simple email. CSAP is the Canadian Society of Exercise Physiologists. We have Exercise Medicine Canada, ACSM, American College of Sports Medicine, which is who I'm certified through, and then you have your Physiotherapy Association of BC. So if you're exercise professionals coming through one of these governing bodies, then they're coming with a good knowledge base. Goals. So in clinic, absolutely we're talking about goals, right? We like using this acronym SMART goals. So specific, measurable, action-oriented, realistic, and timely. One of the main goals, or common goals I should say, many patients have is, I want to lose weight. Great, so that's specific, I want to lose weight. Measurable, how much weight do you want to lose? I want to lose 10 pounds. Okay, how are you going to lose it? What's the action you're going to take? Well, I'm going to lose 10 pounds. I'm going to go to the gym 3 times a week for an hour, 30 minutes of cardio, 30 minutes of strength training. Great. Is it realistic? Do you see yourself going to the gym 3 times a week? What if a friend messages you and wants to go for lunch, right? Do you have a backup day, maybe a weekend to go to the gym? And then timely, right? You want to lose 10 pounds. How quickly do you want to lose that 10 pounds? Do you want to lose that 10 pounds in a week, a day, a month? So the general recommendations for weight loss is about 1 to 2 pounds a week. So if we go on the lower end, 1 pound a week over the course of a month, that's 4 months. And then over the course of 3 months, that works out to about 12 pounds, right? You just took a goal of I want to lose weight to I want to lose weight. Specifically, I want to lose 10 pounds in 3 months. I'm going to do that by going to the gym 3 times a week. 30 minutes I'm going to spend doing cardio, followed by 30 minutes of strength training. So an hour total in the gym. And if I cannot make it one of those days during the week, my backup day is a weekend day, like a Saturday, so that I can make up, okay? And you just took this, goal, made it more bite-sized, and it's a lot easier to be able to achieve that. So we do that with any goal that you have in the clinic, so we can set yourself up for success. So some next steps here. So if you do feel you want to book a one-on-one consult with myself or my colleagues, then we can have you reach out to our program coordinator, and they'd be happy to facilitate that. In some situations, after going through your assessment, you may have increased risk factors for developing cardiovascular disease. So if that's the case, we may refer you over to a local cardiac rehab program in your area. We have local community programs in companies like local exercise professionals, bladder cancer supportive care groups. So feel free to touch base with our program coordinator for more information around that. We have HealthLink BC, 811. So many of you may be familiar with this, especially during COVID, where if you felt sick, you could talk to a nurse and they will let you know whether or not to go into the hospital, right? Today, we actually have various clinicians, whether it's dietitians, nurses, obviously, but we also have exercise physiologists whom you can speak with. And so if you can't get in touch with myself or one of my colleagues, then you can reach out to this number, ask any questions you may have, and they'd be happy to help out. And then lastly, we have a research study. So we are a research initiative clinic. You got to remember the research that was done 10 years ago is helping the patients now. And the research done today is going to help patients 10 to 15 years down the road. So you may be approached, and of course, it's a personal choice if you are wanting to be a part of these studies. But if you can, be highly appreciated. But if you choose not to, then that isn't a concern either. Okay, so to summarize, we're going to do aerobic exercise. So most days of the week. This works out to an RP of 3 to 5, so moderate to somewhat hard. You can talk, but you can't whistle or sing. We want to aim for at least 30 minutes or more. So this can include walking, running, cycling. We want to aim for resistance training at least twice a week, 8 to 10 exercises targeting the major muscles of the body. So 2 to 4 sets, 8 to 12 reps per exercise with 1 minute rest in between sets. So we want to aim for 15 to 45 minutes, and this can be body weight, dumbbells, bands, anything that's going to put that external bit of resistance on the body. Flexibility. So this ideally is recommended most days of the week, especially after exercise or a warm shower. So your muscles are much easier to lengthen out. Intensity should be light, so there should be no effort here. You should feel a mild stretch, but pain-free. If you do feel pain, then ease up on the stretch. A routine can be anywhere from 10 to 15 minutes. It can be a full body stretch. It can be yoga, whatever you choose. And then finally, we finish off with balance, right? So frequency of 1 to 2 times a week. Include more frequency if you are over the age of 65, have osteoporosis, or your balance is poor. Again, light effort. You do need to feel slightly wobbly, right? So you can't just be standing there. So slight wobble to the feet or around the ankles. Just make sure you have something nearby for support. So if you do feel like you're going to fall, you can hold on. And the types of exercise include single leg, heel to toe. You can use a Bosu ball, pillow. So the goal is to move more and sit less. So if you are interested in booking in with one of our clinical exercise physiologists, or if you just need more information about our program, feel free to reach out to our program coordinators, and they'd be happy to help you out. It's been a pleasure chatting with you today. I wish you all the best in your exercise journey.